Make sure to like and subscribe and hit the notification bell to receive helpful tips on how to relieve pain. If you have any questions, put it in the comment section down below.
So about 10 years ago, I had 5 different neck fusions. There were neck surgeries for my neck, and the last 2 were fusion of C5, 6, and 7.
So you had 5 surgeries
5 neck surgeries.
For the same area?
For the same area.
For the same area. So they, what, can you get like brief history why they did 5?
Okay, for the first 2, they're more non-invasive. I didn't want to go the full route of a fusion, so they ended up doing laser. And trying to, I had 2 herniated discs, so they went in there to try to burn part of the disc, so go to connect together, so alleviate some of the pain. After the first one, I still had problems, so they scheduled a second one. The second one still had problems, so I went to a different orthopedist, both were orthopedists, and they suggested that I would have a neck fusion because now they think it was more complicated after the MRI.
So that's the 3rd surgery?
The 3rd surgery.
Okay.
So he ended up, the orthopedist did 2 surgeries. He did one and then a follow-up one for some bone spurts that I had in there and to clean it up. Within a year later, I still have the same complications of tingling in my arm, especially in the right arm and the fingers. And so I was living in Florida. I came back to California and had a neurosurgeon finalize and do the whole surgery all over.
That's the 5th one.
The 5th one, but they actually fused 7 as well. So it's 5, 6, and
7. 5, 6, and 7. And that's you've been having the neck issue for how many years totally now?
I've had tightness in the neck for over 10 years. That was the last surgery.
10 years. Okay. So after that, what kind of treatment you had to loosen up your neck and get the range of motion?
Chiropractic, physical therapy, tried some things on my own to loosen it up, just different things, and still was always had tension in the neck. So
can you tell me what kind of symptoms you currently have now?
Just very tight. The neck is extremely tight when I move it. I
very
feel
stiff.
The tightness. I feel kind of the pain in between the inner, like the pec muscles.
The pec muscles. And when they did the incision, they went from the front and back, or back?
3 of them were in the front, and 4 were in the front. The last one's in the back.
Last one's in the back. Okay. So you said you had a chiropractor, you had a PT, but you still have that limited range of motion. Do you feel pain?
Mild pain, but especially if I use the muscle more, like working out and stuff, then I'll feel it a little more.
Okay, so let me see your range of motion going on. Wow, that's tight.
Yeah, I can feel it. You can feel it crack, and it is tight.
Okay, it's tight. Backward? You're very limited.
I feel it's like...
And going down this way? Okay. Let's do side bending. That's tight. Did you feel any pain?
Yeah, I mean, it's tight, extremely tight. So a little pain. Like,
if we rate your tightness from 0 to 10, how much tightness?
I feel the tightness like an 8.
8.
Pretty, yeah, tight.
Your neck
pain maybe like a 4 or 5.
Where did you feel it?
The pain, just when I pull it, I'll feel the pain right here.
On that side?
Yeah.
Okay.
If I pull this way, I'll feel it this way.
All right. So yeah. So I'll take your range of motion just to get. Oh, you multitask now.
I'm trying.
Good. Okay, so I want you to. Okay, I want you to bend your head down. Okay, so this is it's about 52 flexion backward. And this is 45 extension. And we're going to do the rotation. Rotation to the right, turn to the right. It's hard to see it from his hair, but it's 45. To the right, to the left. It's 45 actually. 45 both, left and right. So we're gonna do the side bend from the back. Side bend to the right. So this is 22 left. It has more to the left, okay. This is 30. 2020. Anyone work on this area?
No.
You feel close.
You feel hot?
Yeah.
It's just you can't hear it because of the car, right?
Is that too much?
Yeah. Yeah. Okay.
Okay. Did you have any head trauma?
No.
Close. Do you get headaches?
Not really.
Mm-hmm. That's okay. Do you have neck issue over 10 years?
Over 10 years, yeah. Tightness.
Yeah, the tightness. We are in 2018. Yeah. And cut it.
2.
So one.
I think they use the same line.
They use the same one line? Yeah. It's right in here. Can you see that?
No.
You can come closer. Yeah. Yeah, they did a good job. Yeah.
It's
Just
just the
cut
back one
here.
has a scar. But
Yeah, the back one is very obvious a scar.
Yeah.
So I'm just working on removing that. Sorry. Okay, so let's bend your head down. Okay. There you go. So that's 60. Okay. 52, 60, this is back. 5 degrees. Backward. Extension, how much it was?
45.
Okay. And that's a 50. You see that? Okay, 50. Good. 5 degrees each. So rotation, left and right, how much it was?
45.
Each. Okay. So can you? Okay. So turn to the right. All right. And that is 1 second. It's right here. It's 58. Can you see that? It's hard with 58. Okay, let's turn to the other way. Okay, and that is 60. That was 45. 60 here. 60. That's nice. Yeah, it's, we have more work. I know we can get more range of motion. We'll do more work. We'll do it next session. Did you have this range of motion before, or it was limited?
It was
very limited since the surgery.
Since surgery,
yeah. Okay. So yeah, thank you so much.
Thank you.
Yeah.
You can treat your pain at home and get similar results as what you just seen in this video. Simply click the link on the screen to start our home treatment program and begin your journey of healing, or go to asterinstitute.com.